Hi, I'm Sunny.
And I'm Michelle.
And we're Pharmacists on Call. In the pharmacy, we get asked a lot of questions about self-care options. So today, we wanted to share with you what we would tell our patients when it comes to acne.
And at the end of the video, Sunny and I will share how we personally fight acne, so stay tuned for that. And we'll link all the products mentioned in the description box down below. And let's get started.
Let's go!
Alright, so let's talk about what causes acne.
So there are many different factors that contribute to formation of acne, but for this video, we'll focus on the two main causes of acne. The first one is overproduction of sebum plus overabundance of dead skin cells together. They combine this goopy, gunk, sticky, nasty goop.
Sounds yummy.
So this gets stuck in our pores and clog our pores, eventually forming bumps, and we call these comedones. And we call this type of acne comedonal acne. So we have open comedones where the gunk gets exposed to the air and oxidizes. And when it does, it turns black in color, and that's what we call them blackheads. And then we have whiteheads, which are comedones that's covered underneath the skin because they're so deep down inside the pores. So it's very difficult to extract them too, even when you try it. And this type of acne is what I typically get.
So the second main cause of acne is P. acnes infection. So P. acnes is the main bacteria that causes inflammatory acne, such as pustules, papules, cysts, and nodules. So P. acnes thrives in anaerobic environment, which anaerobic means either no or limited oxygen. So when our pores are filled with sebum and dead skin cells, that limits the oxygen that comes through. Hence, our pores make it way more habitable for these bacteria. This is also why when we wear face masks, we get those angry pimples, and that's what I usually get. And it actually turns out that P. acnes is found on even healthy skin.
So how come for some people it causes acne and for some people they don't?
Okay, so that's a very good question. So some scientists believe that there's actually different strains of P. acnes, and some strains can cause the pimples that we see.
So what are some over-the-counter options?
Alright, so first let's talk about salicylic acid. So salicylic acid is a type of exfoliant. So it's not an anti-acne ingredient per se, but what it does is that it helps unclog pores, therefore it reduces comedogenesis. So therefore it's good for those comedonal acne. Alright, so this comes in many different formulations, moisturizers, cleansers, toners, and serums, but we recommend it in cleansers because it reduces the contact time, which will reduce irritation, especially if you have, sensitive skin like yours, or if you're going to be putting on anti-acne products afterwards. I don't know, La Roche-Posay.
La Roche-Posay.
La Roche-Posay, I don't know if I'm saying that right, but has one that comes as 2% cleanser. We also have here Clearasil. Clearasil has one that's 2% cleanser, and then also we also have another one. This is a popular one, Neutrogena Salicylic Acid 2% cleanser as well.
And then we have retinoids, which are vitamin A derivatives. So what they do is they keep the pores clean by speeding up the regeneration of new skin cells. So the new skin cells push out the old skin cells that could clog the pores. And because clean pores allow more oxygen in, the P. acnes can't really thrive. Retinoids are also anti-inflammatory. They not only keep the lesions calm the lesions or get rid of the lesions, but they also keep them away. We have Differin Gel, which is available over the counter at CVS, Walmart, Walgreens, everywhere now. They also have generic versions called Adapalene. So this was revolutionary because this was only available with the prescription up until recently.
Oh, shocked.
Yeah, seriously. I was like, yes, finally. So this was pretty revolutionary. It made prescription retinoid available over the counter. And then we have Curology. Obviously, this is not sponsored because
we're not there yet.
I don't know if we ever will be, but Curology, we're putting in our over-the-counter options because this company or this brand allows for us to get retinoid without a prescription, just subscription.
Ooh.
Rhyming. So yeah, so they formulated this for me personally, not personally, but they formulated this for my skin type. They have clindamycin 1%, which is antibiotic, azelaic acid, and tretinoin.
Wow.
So yeah, it's interesting. Tretinoin actually, not tretinoin, Curology also has these active ingredients that they are, I guess, able to use to formulate a product.
What do? Like you fill out a questionnaire or something?
Yeah, they have a lot of questions, and then they also tell you to like take a photo of your skin.
Oh,
so
interesting. I've never tried Curology before.
I had to do that, which is really like...
I'm just surprised that
Isn't it
clindamycin has one... I mean, this has clindamycin in it.
No, but they have azelaic acid, which is in Phanesia, which is a prescription medication. They have niacinamide, which is available over the counter too, but it has metronidazole. Metronidazole is also a prescription ingredient. Clindamycin, which is a prescription ingredient.
Interesting.
Yeah, zinc. Tranexamic acid. Tranexamic acid I actually had to like look into because this in the pharmacy we use it for like over bleeding.
Yeah.
Like very heavy menstrual cycle. So I was like, what are we doing with this? But supposedly they have some clinical trials that it could help with melasma and post-inflammatory hyperpigmentation.
That's so interesting.
Yeah. So Curology is able to use these prescription ingredients, which is very interesting. So that's why we put it in our over-the-counter options. So retinoids are only to be used at nighttime. It is a very strong ingredient, and if you heard of retinoids or vitamin A or retinol, anything like that, you would know that there is a stage called purging stage, and that's because you're introducing this ingredient too strong and too fast into your skin, into your routine. Go slow, use once or twice a week first. And also, if you ever heard of tretinoin from a dermatologist, they would also tell you wait 20 minutes after you wash your face and then apply it. That's because on damp or moist skin, right after washing your face, your skin is able to absorb ingredients a lot faster, which means tretinoin can, penetrate deeper and faster, leading to more side effects. So our tip, pharmacist on call tip, is if you don't want to wait 20 minutes, you can try using a few drops of jojoba oil. So this is what I use, jojoba oil. Just use a few drops of this to mimic the oil that our skin would have naturally produced within that waiting time of 20 minutes. And then you use it with the tretinoin, and you could avoid that purging stage or that painful burning peeling stage. Yeah.
Yeah, I couldn't do it.
Yeah, but this is how I introduced to my skin, and I've been doing okay.
So let's talk about spot treatments. So benzoyl peroxide. Benzoyl peroxide is probably the most popular spot treatment out there. It's an antibacterial ingredient and is actually a bleach, which is why you can see you can end up with bleach stains on your clothes and your sheets. So actually a fun fact is that it used to be used for over 50 years to bleach flour and milk to make Italian cheeses.
What?
Interesting, right?
Fun fact.
Yeah. All right. So unlike salicylic acid, benzoyl peroxide is scientifically proven as an anti-acne ingredient. But of course, it won't clear everybody's skin because acne can come about for a variety of reasons, such as genetics and stress. Right, so studies have shown that lower concentrations of benzoyl peroxide, such as 2.5%, works just as well as 10%, but with far less side effects. So our pharmacist recommendation is lowest effective dose. Definitely, please pick up the lower concentration before you pick up the higher concentration. Just trust us on this. 10%, I've used it maybe when I was, last time I used it was probably when I was, before I became a pharmacist. But when I was young, I went straight to the pharmacy aisle and picked up the 10%, and I think
the maximum strength.
And I think I practically like kills that part of the skin.
Yeah, it burns the skin away.
Yeah. Anyways, so La Roche-Posay makes one in 5.5%. We have one here from CVS. It's a generic brand. It's benzoyl peroxide 2.5%. We also have one here from Clean and Clear. This one is 10%, so we'll be throwing that one away. Alright, so if you have body acne, you can try benzoyl peroxide. It comes as a cleanser form. So Differin has one, I think, in 5%. Panoxyl has one in 4% and 10%. Don't try the 10%, go for the 4% first, alright?
Alright.
So So another popular spot treatment ingredient is tea tree oil. So studies have shown that tea tree oil works just as well as benzoyl peroxide, but with far less side effects. Only thing is that it may take a longer time to see the fuller effect. Some by Me has one and the Body Shop has one. So can skincare products treat acne?
So this is a huge topic. We might have to go in depth in a separate video, but the answer is yes and no.
Yes. So if you have mild acne like me, skincare alone may address this issue. So there's many products out there with amazing ingredients like Centella asiatica, retinoids, tea tree oil, what else is there? HA, green tea,
Niacinamide,
azelaic acid. But you just need to pay close attention to what your skin needs when it needs it. So depending on your skin type, the ingredient that your skin needs may be very different. Also remember, your skin is very hard to please, like me. So it's never consistent all the time. So just be proactive with checking in on your skin condition.
But if you're like me and skincare alone couldn't quite clear the skin completely, try combining acne medications or acne treatments with a good skincare routine. If you marry the right products, you'll see synergistic improvements in your skin.
It actually sounds like a marriage advice.
That's true. Gotta marry the right person. And remember, acne medications can be harsh and irritating to the skin. So when it comes to skincare, you want to make sure you use more of a gentle, soothing, repairing type of products. And you can check the description box down below. We'll list all the recommendations that we have for gentle makeup removers, cleansers, toners, serums, moisturizers, sunscreens, and everything that's good. Can dietary supplements help?
So this too can get very long, especially if we start talking about herbal supplements. So just let us know and we can expand from there. But for now, let's talk about a few that are very promising.
Here we go. So we have Pantothenic Acid, which is vitamin B5. So that's what we have right here. This is a water-soluble vitamin. And the exact mechanism of how it fights acne is not very clear, but they attribute pantothenic acid's antibacterial and skin softening properties as possible mechanisms. This received a whole lot of attention in acne community because of one study that used mega doses. And I'm talking really mega doses. Typical dose of pantothenic acid is maybe 500 to 550 milligrams a day, but they were using 2 tablets of 2.2 grams, which is 2,200 milligrams, twice a day. So in total, that's 8,800 milligrams of pantothenic acid that they were taking. But the study's results were very promising. The test group had significant improvements on their acne lesions. And if you look at YouTube or Google, they have so many testimonies about this too. The only thing is, 8,800 milligrams a day seems a little too much.
Yeah.
So now there have been some studies saying or speculating that L-carnitine can boost the effect of pantothenic acid. So the new regimen that they're trying out now is 750 milligrams of pantothenic acid 3 times a day with 250 milligrams of L-carnitine 3 times a day. That seems a little bit more reasonable. That's something that I would try personally. And there have been some complaints of people using 10 grams or close to 10 grams daily dose, that they are having a lot of hair loss. And that was interesting because water-soluble vitamins, typically if you reach a certain level in the body, it gets excreted through the urine, so it really shouldn't have side effects. However, if you are mega dosing, it is possible that the pantothenic acid decreases absorption of biotin, which is a vitamin that's essential for hair, and that may contribute to the reason why you get hair loss when you're mega dosing. So if you are thinking of mega dosing on pantothenic acid, you might want to use biotin as a supplement.
So zinc. Zinc fights against P. acnes and is anti-inflammatory. It's even shown to decrease sebum production. Many studies show improvement in acne lesions with zinc supplementation. However, you want to take zinc with food because if you take it on an empty stomach, there's a higher chance of GI upset, such as nausea, vomiting, and diarrhea.
And I personally experienced this. I threw up at work in the pharmacy.
Oh yeah, I remember that.
Right
nothing
after,
to laugh about.
No, but right after I got out of the car, I ran into my pharmacy, grabbed the plastic bag, and I threw up in the plastic bag. It was really bad.
Oh, so basically learn from Sunny and take it with food. And also zinc may decrease copper absorption in our body, so you may want to supplement with copper if need be. So vitamin A. Vitamin A reduces sebum production and can prevent P. acnes infection. So a lot of you may have heard of this oral prescription called Accutane. Accutane is a vitamin A analog. Vitamin A is a fat-soluble vitamin, which can cause liver toxicity if you take in large doses. So do not take more than the recommended dose, and it's not ever to be taken in mega doses as B5 is.
Omega-3. We all heard about omega-3, how it's so beneficial for our health. It's also beneficial for acne-prone skin because it reduces sebum production. And because of its anti-inflammatory properties, studies have shown that with omega-3 supplementation, you can have decrease in acne lesions.
All right, so let's talk about what we're doing for our skin.
Yes.
Okay. So for me, I get more inflammatory pimples. So it's more of those like 3D yellow pus fills, you know what I'm talking about, that kind of pimple. Those are called pustules. So sometimes they get like painful and inflamed, but thankfully I only get like 1 or 2, 3 if, you know, sometimes my skin is an overachiever. But typically I usually get it on my cheeks. And so I used to extract them and, you know, it'll shoot like 2 feet away. That's how I got acne scars actually. So for me, I have more like normal, non-sensitive skin. So skincare alone has been working out for me. So I want to go through what I do at home. So for me, I cleanse. Usually I use like a salicylic acid based cleanser because like we said before, it keeps the pores unclogged and it'll whisk away the dead skin cells. Then I'll go with my toners and serum, moisturizers, spot treatment and everything. And then I use this. I use an occasional exfoliant peeling treatment. This one that I have, it's backwards, it's from Dr. Oracle. It's called Athera Peeling Stick. And this is, here, I'm going to show you, but this is soaked in 6% AHA, let me open it from the right side, AHA, BHA, and tea tree oil. Okay, let me show you. But I use this about 1 to 2 times a week.
Whoa!
Look how big this is.
That's massive. That's a massive.
So look how, there's actually so much formula on this that I use it on my face and I'll go in with my neck. So I allow the formula to sink in maybe about for a minute and then I'll continue with the rest of my skincare.
Can I smell it? Does it smell like tea tree?
Can you see?
Yeah. It smells delicious actually.
Like a little minty actually.
Oh.
Okay, anyway, let's close that up. Alright, so now I also want to talk about this thing that I have. So this is a light therapy. The one I have is from Lightstim. This is actually FDA cleared to treat acne. This is an at-home device to treat more like mild to moderate acne like me, and it kills P. acne causing bacteria. Let's try this. Okay, so this uses actually 2 types of light. Let me turn this on. So you'll see, I don't know if you can see this well, but it has blue light and it has red light, and I guess it looks purple here.
Is it?
Right. So the blue light is used to zap P. acnes, while the red light helps decrease inflammation.
So pretty.
I know. So yeah. So this minimizes breakouts and calms existing blemishes. So there's really not much high quality evidence for this to treat acne. So this is my personal review, but I absolutely love this. Okay, so how I use it is after I cleanse my face, I'll turn the light on and it has actually a 3-minute treatment timer. So I go in on my skin, like on one section, I'll turn it on, and then after 3 minutes, it'll beep, and I move on to the next section. For me, like I use this daily when I have an active infection, but once my skin clears up, I'll go in, maybe use it like 1 to 2 times a week to maintain my skin.
That's so cool. Can I see? Yeah. Does it feel hot when you use it?
Yeah.
How close do you have to be?
I put it like right on my skin.
Oh.
Yeah. I can definitely tell a difference in my skin.
Oh, that's cool. I remember when I used to get facials, they used to give me like a light therapy with the big fan looking thing. And I think it was blue and red.
And that's how I treat my acne.
Wow.
Alright, so and this is Sunny's routine. I don't know how many feet this is, but...
So my skin type is very easily dehydrated, extremely sensitive, extremely acne prone skin. I don't get the inflammatory acne, but I do have severe comedonal acne. And so using the right skincare products alone helped my skin improve about 70%. But that 30% I did have to use anti-acne medication. Basically, this is how I cleanse my face. I use a very gentle cleansers and add the salicylic acid 2% to my cleansing routine. And then I use toners and serums that are more hydrating to make sure that my dehydrated skin doesn't overproduce sebum as a coping mechanism. So this is for that. And then I would add a little bit of jojoba oil to my skin just before I use my Curology because this has tretinoin in it and I don't want to irritate my skin. And then I would use these two creams to lock and seal all the good stuff that I have put on.
So this is definitely like the definition of that Korean, like what, 12, 20 step skincare routine.
Yeah, it actually had helped me so much. Now, it's just doing this alone improve my skin.
That's
plus
one
this,
thing.
plus this. Oh, this is Pantothenic Acid that I use one capsule twice a day, in the morning and in the evening. But doing this alone helped my skin improve about 70%, and adding this to my routine improved my skin 100%.
Ooh.
Yeah, so, oh, it's Domino's. So that's my routine. If you guys want more specifics on our skincare routines, let us know. We will do a very detailed video on it.
But can I ask one question?
Yeah, sure, go ahead.
If I were to choose one product from here that changed,
life-changing.
or what was like your one life-changing product?
That would have to be Curology.
I want to try that.
Yeah, you know what though? Honestly, skincare products are more like the natural way to improve skin, right? When you introduce like the Western medicine, it's just, it has to work. It has clindamycin, it has tretinoin, it has to work. So that would be that. Good question.
Right.
So this whole video,
This whole thing,
everything, plus what we talked about before, it was a general overview of it was a general overview of what we would recommend to our patients when they come and ask us in the pharmacy.
Yeah, so if you have any questions about anything that we talked about, or you want us to discuss anything in further, just leave us comments in the comment section down below.
Thank you for watching. And remember, we're always on call for you.
So see you in our next video.
Bye.
Bye.